Hey everyone, this is Stephanie Lally. I'm starting on blog number 3, and this is about leadership skills and organizational structure. So the first question is, how would I function as a manager in the organizational structure and using the model of care that we reviewed during the practice experience. So first, I believe as a manager, my interpersonal skills would probably be the greatest strength for me in being a manager, in that before nursing, I actually got an undergraduate degree in advertising and communications. So I studied people. I studied how to communicate with them, how to speak to them, what they want to hear. And even after that, I became an assistant manager at a chiropractic office where I was a jack of all trades. I filed insurance, I dealt with customers, I made appointments, I managed the therapists that did the therapeutic modalities for our clients. So I really had great skills there, and definitely the main thing was that we had teamwork. And even currently being in a profession where literally your whole day is dealing with patients and their families. I mean, and if you're not dealing with patients and their families, you're dealing with a member of the interdisciplinary team. So I think that all of us really have fine-tuned skills in these areas because it's what we do. So some skills from the leadership questionnaire that I would use to secure needed resources such as staff. It really goes back to those their interpersonal skills that I was just talking about. So usually knowing ahead of time how people are going to respond to a new proposal or idea, or a change in the way that we do things, or understanding the social fabric of the organization you work for, or really being able to fine-tune and sense the undercurrents of an emotional climate in your team. Those are super important, and things that I would use in order to get resources. I just feel like personally one of my strongest skills in my whole life is having an innate ability to just sense that energy in a room, whether it's visiting a patient's room or whoever you're working around. So administrative wise, I actually scored low on the leadership skills questionnaire, and I think part of that is because it just doesn't interest me. It's just not something I've ever really wanted to do. Management is not somewhere I truly see myself. I've never seen myself at a desk job. I've landed at a couple, but so I think it's not that I don't have the skill or capacity to do the administrative work, it's that I'm just not interested in it. So the last thing, the conceptual skills, I also scored high on, which will be useful in managerial strengths for retaining and acquiring resources as well. So the next question is, how would you use the published literature in the process? So the article I found is from the Journal of Occupational Rehabilitation, and it's titled Transdisciplinary Teamwork, the Experience of Clinicians at a Functional Restoration Program. So the concept of teamwork was developed back in the 1980s, where there was recognition basically that no one person had the skills and the knowledge to deliver the high quality care that we've come to realize patients need. So currently, teamwork is heavily relied on in the fields of healthcare where patients have complex needs, which is a lot of them now, and require a team of healthcare professionals encompassing a wide range of skills. So This type of teamwork is what's referred to as what we know now as interdisciplinary care approach. And although this article specifically focuses on talking about a rehabilitation center and the interdisciplinary success with rehabbing patients, the effectiveness of this kind of approach is wide scale. It's not just with rehab, and it's been advocated for a broad range of healthcare fields: developmental disability, community mental health, long-term care, primary care, rehab, gerontology, healthcare education. So currently at my hospital, we do this every day in the ICU. We get our whole team together and we go through each bed. The nurse comes up and the team is waiting there, and they discuss, the nurse discuss their patients with the team, and then as a team we decide for the day what everyone is going to do for that patient in order to give them in order for them to heal and get the holistic care that they need. And this is everyone from pastoral care, nutrition, PT, OT, wound care, doctors, nurses, clinical case management. So it's a really great thing. And so with this article, I would just bring it as a positive way to reassure that it's interdisciplinary care is effective in a team setting like this. So the levels of the departments that I would need to work with in order to be effective in a managerial role, there's a lot of them, but the nursing house supervisor, director of nursing, managers of different units. Say you're getting a lot of transfers from the ED to your floor, or you transfer a lot of patients from your floor. Say you're an ICU or progressive care unit and you're transferring to general med-surg floor after they improve. It would be pretty smart to have a good relationship with the managers on those units, and assistant nurse managers that can help take some of your workload and delegate tasks and handle minor fires that need to be put out. Nurse educators for the units, physicians, surgeons, and then you have your bread and butter, your nurses, your charge nurses, your resource traveling nurses, nursing assistants, your everyday staff. It's imperative to have a good relationship with them and to work with them on a daily basis and be known and be present. So my preference between a vertical and horizontal structure model would be a vertical structure model in this circumstance, especially if you're in a larger hospital. Companies with tall organizational structure are better at delegating and designating tasks to employees or departments within the company. In our case, it would be units within the company. And they have well-defined responsibilities for employees. Now, obviously, a hospital is not black and white. There's a lot of gray, but I think it would be generally easier to manage in a vertical structure. Although I think that there should not just be just a vertical structure or just a horizontal structure. I think that it would be nice to implement the best of both worlds. It was noted somewhere that I read that horizontal structures have a higher employee morale. Excuse me. And that may have to do with the fact that the managerial positions are involved in the more day-to-day tasks, and they're more present than in the vertical structure. So that's why I think that integrating a little bit of both would be great, but vertical would be my position. Thanks.